This is Andy Schumann for MedGizmos with another technology review. I have the pleasure of speaking today with Pedro Sanchez de Lozada, who is the CEO of an interesting company called Canid. Am I pronouncing that correctly?
Correct.
Okay. And can you tell me just a little bit about yourself? I understand your company is a startup, so I'm fascinated by people who are smart and creative and realize that there's a lot of obstacles to creating something innovative in medical care. So tell me about yourself. You're a West Coast kid, from what I understand, or person.
Actually, I'm originally from Santiago, Chile.
I see.
I've been
Okay.
in the U.S. for about 12 years, though,
Okay.
in which I've moved all over the country, including San Francisco, D.C., Chicago, New York now, and this is where I am today. But a little bit about myself and kind of where the idea for Canid comes from. So I come from a background of building technology platforms that help the little guy thrive, the little small business. By little guy, I mean small business, and be competitive with these larger organizations through great software. Companies like Udemy, which did this for online educators. Rinse did this for dry cleaners and laundry companies. And Merlin as well, who specifically focus on the hiring process for restaurants and retail stores, small restaurants and retail stores. And so those have been the companies that I've helped build from the very beginning, and helped get them to where they are today, all of which have been successful. Merlin, who was successfully acquired in August, and Udemy and Rinse, who continue to grow at a pretty amazing pace. Now, that's maybe aside from what really brought me here, where I've also been a partner of my mother's pediatric gynecology practice for the last 6 years. And especially as the pandemic struck, her and her colleagues found themselves needing to truly reinvent how the administration of their practice happened, and bring it all into digital and really change a lot of things of how that operated. And it was really eye-opening for me to see how the software that I had come to expect on my day-to-day was really nowhere near what I expected it would be for businesses in pediatrics. It's something that struck me as even more interesting when I started to look into vaccines, given that was one of the most important public health innovations of our lifetimes, right? And pediatric practices a lot of the times were operating at a loss while working on vaccines, and doing it in entirely manual ways with large operational teams within each practice. So that's really what kind of triggered the events that later led me to start my company, which has been around for about a year now. And as I started to dig more, it became really clear how, given how pediatrics focuses on preventative care, those pediatricians to some extent have been neglected by modern healthcare community, especially in technology, despite how critical and invaluable they are for society. So we built Canid as a way to change that.
Okay, Pedro, I'm going to pause right here. By way of background, are you trained and educated as an engineer, as a programmer? Are you self-taught?
Yeah, so actually I, by education, have been an economist. And so when we talk about building technology, really my focus has always been on growing and getting adoption for great technology, as well as understanding what the customer needs are, so that we can inform our engineers to work that way. And that's how we work today, where I'm basically working with the pediatricians, setting up their practices, while our team of engineers will develop out the products that we need as we continue to expand.
Okay, and it sounds like you have a success record regarding startups and build outs in other industries, correct?
That's right.
Okay, very good. And you mentioned that is it your mom who has is it a pediatric oncology practice?
Gynecology.
Gynecology. So it's not, is it a pediatric gynecology practice or just a gynecology practice?
It's a pediatric, so it's specifically focused for young women and adolescents, and they
Understand. Yeah. Okay. And is that where you live now? Is that back in Chile or?
Yeah, so that is back in Chile. My uncle has a private practice here that I've also worked with through the pandemic. But yeah, that's back in Chile.
Okay. And where is your company based out of? I didn't notice that.
In New York City.
In New York City. Oh, that's awesome.
Yeah.
I grew up in New York City. I went to Stuyvesant High School. I went to New York University and New York University School of Medicine.
Nice.
I'm still recording this, so I miss the bagels and Ray's Pizza and Goldberg's Pizzeria. So I'll probably keep that in the video. Okay, so very good. So I'm very interested in what you're doing, because I understand that my state of New Hampshire on the immunization registry map is like the only one that hasn't implemented anything yet, and we're just starting to. And from what I've read, registries have been around for a long time. The concept is a good one. The idea is to facilitate communication, so a patient with a immunization record can then travel throughout the country, and that information travels with them and can be accessed from anywhere. So you and I had a discussion previously, and you enlightened me regarding the fact that there's something like 64 registries. Is that right? Is 63, 64? A lot of them at the state and city levels, and a lot of them are very good, and a lot of them are not so good, and they don't necessarily communicate with one another. So why don't you tell me what your company does and how it interfaces with the existing state and local vaccine or immunization registries?
Absolutely. So I think you bring in a really good point, especially around New Hampshire. And we discussed this last time we talked, but the reality as to why it's so hard to impose kind of a requirement to report is because it takes a long time. It's a pain. These small businesses, they don't have extra cash just to hire someone to do this, nor is it anything that's exciting to be doing when you, both as a physician and even an administrator at a physician's office, you want to be focused on taking care of your patients, right? Mm-hmm. And so I think as a healthcare community, we've done okay with creating these registries, and that's a really good thing. But what we haven't done well is enabling those businesses to interact with the registries in a seamless way, right? And that's to some extent how Canid, one of the things that Canid does is we make it so that by simply scanning the bottle and selecting from a pre-imposed pre-imposed person that's being extracted directly from your electronic health record system, that you're able to make the assignment of this child received this vaccine and then automatically get that uploaded to the relevant registry, right? And that makes it so that instead of you typing it into a CIR outdated system, it's a simple scan, go, you're done, right? So that's on one side, and we do integrate with a lot of those registries today. Now, you also mentioned the lack of communication between these, and in practice, the issue that has is that if someone moves, right, they either have to be looking at their records in these different states, right? Or they have to be, or they just don't have the records for their vaccines, right?
Right.
And so that not only affects the patient's care, but it also affects the knowledge that the physician has of what care this person needs, right? We have this kind of CDC guideline of like what vaccinations everybody needs, and so pediatricians who want to do the work of being proactive with their patients can't really do that if those people are moving around. And especially that might not be a huge issue if we're talking about California and New York, but it is a huge issue when we're talking about things like in New York City, there's a different registry than outside New York City, even like right outside, right? So you cross the border of the city, you're already dealing with a completely different registry. Mm-hmm. And so one thing that we also have done is being able to extract information from these registries and aggregate those associated to a patient, right? Allowing you to see when there are people who have not received the right immunizations, and flagging those for the doctors so that it's easy to identify and so that we can be proactive about making sure that they get them. Mm-hmm. So I think, one other thing that I should mention is that there is now with the COVID vaccine some really interesting initiatives around making more global immunization registries, and I think those are likely to pick up some nice steam based on these improvements that are happening today. While we have this, while we don't have that yet, at least not global, immunization registries are the best we've got, so we work with them, but we're excited to hopefully be able to be a part of that movement as well.
Okay, I want to put this in perspective for the viewers of MedGizmos. We had a dialogue, and if I remember correctly, obviously you know this topic inside and out. So in my state of New Hampshire, the state purchases vaccines for everyone independent of insurance. So my practice does not have to purchase vaccines independently through a middleman, through a distributor, direct from the company. But that's the minority nationwide. I think you mentioned that 40 states have systems where VFC kids get state purchased vaccines, but in those 40 states, practices have to purchase their own vaccines. Is that correct?
That's correct, yeah.
Okay.
I actually think that the numbers are, there's 9 universal states, I believe, and then there's 3 that are kind of partway universal. They don't actually subsidize all of the vaccines. Mm-hmm. And then those 9 are very similar to New Hampshire, and 3 that don't subsidize all of them, and then the rest are all the private practices need to spend their own money to buy those vaccines.
Okay, and I understand too there are buying groups, so one can get better prices if one joins a vaccine buying groups. So where is your company in the midst of all this? You say you've been around for a year. You're in business to provide a service and to profit as well. So not only do you do information technology, but are you the middleman between the pediatrician and the company? Is that where your company makes the money, or do you charge a fee to the pediatrician?
Yeah, so,
how does that work?
So the way in which our business model works is when there's a purchase of a vaccine, there's a negotiated buying price based on a buying group, and there's also a negotiated reimbursement price based on an insurance company paying you back for that vaccine.
Yes.
Now, there typically is a margin between those two, right? And so when we do this, we say, look, and not always, by the way, not all pediatricians have that. And it takes some negotiation to get a margin there.
Mm-hmm.
But essentially what we do is we say, look, we're going to do those negotiations on your behalf, and we're going to finance your whole operation. So instead of you having to spend $100,000 a month on the vaccines that you need for your practice, or whatever it is, right? If it's less or more, we've certainly seen a spectrum of businesses there. You won't have to spend that anymore. That won't be on you, and in fact, it won't even go into your books. And we will also work with the insurance company to get reimbursed for that inventory and get paid back for that inventory, right?
Okay.
And we do create a margin for ourselves between those two by negotiating good buying prices and looking at the market, and make sure that we also negotiate with those insurance companies. Now, in these early stages, I will say that we're actually not very focused on the negotiation. We're more focused on the improving the pediatrician's experience. So, we do it at a more break-even level than we probably would at scale, but we're really looking to expand that as we scale, right?
Okay, so you obviously have some sort of funding that lets you kind of tread water as you build out and expand. And I like the fact that you are kind and considerate to my fellow pediatricians, because not many people are these days. So with all this said, so a pediatrician comes to you, or you come to a pediatrician, and we know it's complicated to obtain vaccines and so forth. So what happens is a contract signed between a pediatric office and yourself, and you deliver all the vaccines to us. Do you scan in the barcodes into our EHR? Do you lessen the work that we have to do from our end in any way?
Yeah, so essentially, our goal is to make it so that you as a pediatrician, or any pediatrician, can just focus on giving the vaccine, right?
Okay.
And when we think about how do we achieve that goal, there's a lot of operational steps to make sure that you always have enough inventory.
Mm-hmm.
So we actually track your inventory for you. And it's not just, we upload it into your EHR. We actually have our own system that makes sure that whenever you're dipping below a certain point, we're placing in more orders. And whenever you're, we can also predict and track how much you're going to be using, so that if you have any spike based on flu or anything like that, we can make sure that we can provide for that.
Okay. And did you say that I don't have to write a check to a purchasing company on a monthly basis? I never see a bill from either you or them.
No.
Okay.
Yeah, so that's the other thing, right? So we won't purchase it and use your money to purchase it. We'll go buy it and we'll put it on your office, right? And then when it comes a time to go bill for it, then is when we'll receive our reimbursement for the bill that we.
Okay. Do you receive the reimbursement from the pediatric office, or do you receive it a dispersal from the insurance company in some way? Because obviously, if you've bought enough cars, if it's too good to be true, it ain't true. So expand upon that. Do you get money? There are some technology companies that charge a fee per test, for example, which you have to figure it out. Do you get a fee per shot from the pediatrician?
So I think one thing that's important to clarify to answer that question is that there's a difference between how we want to set up our business in the long term and how we're set up right now. The way in which we're set up right now, we do get reimbursements from the pediatricians simply because it's operationally easiest to go through their existing ways of doing work, right?
Right.
But that we're not charging you additional to what you would get otherwise, right? So let's just
Right.
say you got reimbursed $34 for any vaccine, then you would just pay us the $34. That's it. And because we gave you the vaccine, that is essentially us getting paid back for our own vaccine that we gave to you, right?
Right.
Now, in the future, when we create more direct relationships with insurance companies, which hasn't been a priority for us thus far, then we would get reimbursed directly from the insurance companies. But that's not something that we're prioritizing at the moment. Again, our priority is making sure that the pediatricians are happy and excited and getting everything.
So just to clarify, and I've been in a private practice environment in New Hampshire, so I always got essentially free vaccines. There was an administration charge. So if a practice has to purchase a vaccine from a distribution center, does a pediatrician typically charge above and beyond, or do they just make the administration fee and the cash flows in and out of the practice to fund the acquisition of the vaccines? How does it typically work?
So typically there is markup sometimes, and the interesting thing about that is that how well you get marked up is really more around your ability and your time to negotiate as a practice, right? As well as your ability to make yourself heard within an insurance company's reimbursement policies, right? A lot of the times what we see though with these smaller practices is that they don't have a high ability to make themselves heard with reimbursement, right? And they don't have time to be spending arguing with the insurance company, and then there's 10 insurance companies that they take or however many they take. So really a lot of what we see is people breaking even, right? They purchase a vaccine for $30, they get it reimbursed for $30. Now the AAP recommends that you mark it up 25%, so call it 30 to 38-ish, but that doesn't actually happen in practice a lot of the times, right? And so as an advocate for pediatric practices, part of what we do is also make sure you get that reimbursement at a higher amount. And of course, we keep that percentage, so it makes sense. But for a lot of these practices, it is something where they would otherwise break even.
I see. And just out of curiosity, because I know, my practice does a lot of babies. I haven't counted the vaccines. When I was in private practice, I saw the numbers. So a small practice, and you probably know this off the top of your head, a small practice, 2-3 persons, how many vaccines are administered per month or per year versus a larger practice? Just, off the top of your head. I'm just curious.
Yeah, so we typically see per physician, it's about 20 or so per day. Doses.
Per day, okay.
So if you do that math, would be about 20 times 20 business days, 400 vaccines per month per physician.
Okay. And just out of curiosity, because again, I've been employed for 12, 13 years now. I think vaccines were just a small component of practice revenue, but one that you can't ignore. And obviously, if you can get better reimbursement, the better off the practice is. And particularly if a company like yours does a lot of the work in terms of getting the vaccines scanned and put into the EHR, that's also beneficial too, because that's overhead.
Yeah. So I would actually say, at least in practices that are not universal, right? Not like the New Hampshire practice that you're a part of, but but in practices that are in non-universal states, it depends a little bit on the spread of whether they get a lot of Medicaid patients or not. But if they don't, a lot of the times it actually becomes a really big source of revenue, but it's not very profitable revenue. So essentially, let's say you purchase a vaccine for $30, right? You get it reimbursed for, again, those $30. So that is break even. So you're not actually making that much profit there.
Right.
But then there's an administration fee, but that $30 itself tends to be about the second expense line item for a lot of these practices after salaries. And it could be upwards of half $500,000 to $1 million a year. So it's more, it's a high revenue thing, but because it's not very profitable, it's not very exciting.
So it's all about net and gross revenue. So I understand that. Okay. So your company is, and we talked about this a little bit, is different from a company that functions as a distribution center or a distribution company or a buying group, right? So there are not a lot of companies like yours. And are you unique in what you do?
So I would say that there are some companies that do finance vaccines like we do. And I think that those companies do a fairly good job, but they don't have a big following or a market share because they don't go deep enough, right? And they don't really support pediatricians operationally as much as they need to. So a lot of the things, for example, around uploading information to immunization registries, working with vaccines for children programs, a lot of the practices who do financing, because financing, to be perfectly transparent, we don't make a lot of money from working with the vaccines for children program. That's not exciting for us financially, but we want to do it because we want to simplify. Ultimately, the goal here is to simplify the lives of pediatricians. And if it doesn't take that much extra effort to work with vaccines for children, then we're going to do it, right? And so I think that's a layer of, a lot of companies will basically be like, okay, your private vaccines go in this direction, and we don't do anything else. Like, we'll help you with this, but we won't help you with anything else. Our goal is to make that our business, but also help you with a lot of other things, and to help you with things that will make you care better for your patients, focus more on the actual patients versus the operations, and et cetera.
Okay, so there's two key words in what we've been discussing. One is operations, and the other, if we haven't said it outright yet, is interoperability, because there are several popular pediatric EHRs. A lot of pediatricians still don't have EHRs and still have to participate in registries, which makes things difficult. And for some practices, it means entering data twice, which is a huge amount of work. So let's take us through what you do. A practice contracts with you. How do you make their lives better? Because it sounds like the vaccines pass through your hands, and do you scan them into a database or an EHR?
Yeah, so essentially, we do integrate with electronic health record systems. Some of them we support fully, some of them are a little bit harder. And as you probably know from how much of a conversation there is around interoperability, this is not an easy thing to do. And a lot of the times, especially the smaller ones are harder to integrate. So we don't support all of them. Now, what we do when we don't support it is we want to make sure that you are able to have access to your data and re-upload it into your system in a seamless way. So instead of doing it manually, we would be able to give you an export of data that you could download every night or whenever you can, and re-upload it into your EHR in the format that the EHR requires. That's pretty... And our goal in exchange for that is to say, look, we're going to have you scan everything so that there really is no manual entry involved in using our process. Right. So obviously, like there are some limitations to being able to fulfill everything, but we want to be as close as possible as those EHRs, honestly, as those EHRs would allow us to make this super simple for people and ultimately.
Okay, so walk us through the process. So who does the scanning? Do you do the scanning, or is it the nurse receiving the vaccines that scan the vial of the
So
vaccine?
essentially, when we ship, when a vaccine shipment is shipped, right, we upload it into our system, right? And what that means is that we already have all the lot numbers, all the amounts, everything once you receive it. You might confirm that you've received it so that we get it uploaded, we get it enabled in our system in case there was any problems with shipment or anything like that. But that's it, right? And then, so it's at, the act of receiving those is as simple as, I got the box, I put it in my fridge, and I'm good to go. We've already confirmed that everything's there. And then once you have that database of all of your vaccines in our system, all you need to do is essentially scan the vaccine as you take it out, confirm who you're giving it to, which we also don't have you do manually. We actually, in the cases where we integrate with your EHR, we pull that information from your EHR schedule so that we understand that who's coming in, and you can actually just select the patient that you're working with, and then we match those two together, right? So once you scan it, you match them together. There is also a process of insurance verification so that we can know exactly, if that is a vaccine for children patient or not. That's the biggest reason of why we do it at that stage. And then you scan it and you're done.
Okay. And who does the billing for that? Do you do the billing, and there's the administration fee, there's the vaccine fee. So who's responsible for that?
So in the early implementations of our product, which again is a little bit less what we want to do in the future, but in these early implementations of our product, we basically set up the bill on behalf of the physician and then have them submit the bill, right?
Okay.
So we'll fill out all the forms, everything that's needed, right? Have all the information of the patient who was given the vaccine, what time, all the information that's needed, right? And basically make it so that it's just their process to hit the submit button, right?
Okay. Now, normally, with electronic claim systems, a pediatric practice will charge, for the physical, right?
Yep.
Other services provided there, which may be screening questionnaires with grading and the vaccine. So therefore, the practice would have to submit 2 bills rather than 1, right? But I imagine you have some software system like a portal which facilitates communication between you and the practice. So having to submit 2 claims to an insurance company is therefore not a big deal.
Yeah, so essentially what we tell our practices is just don't include any vaccination details in your bills. We'll submit those in a separate bill, and we'll help you get that set up so that you submit a second bill, and it's pretty seamless to do that.
Okay. And the vaccine charges go on your bill or on our bill?
The administration charges?
Yeah.
It's a case by case, whatever is preferable. We're happy to do it ourselves. We're also happy to let you do it if that's preferable to you.
Yeah, and then you give the money for the administration back to the practice,
Yep.
I assume.
Yep.
Okay, that makes sense. Okay, so let's talk about EHRs for a moment. There's a few big ones that are very expensive. I'm thinking of Office Practicum, which is probably the most popular one, if I'm correct. And there's Physician. It's the one out of, is it Maine or Vermont? Physicians Computer Company. And and the rest is kind of a smorgasbord, next gen and so forth. But those are the two pediatric specific ones. Do you integrate with those now or not yet?
Yeah, so right now with Office Practicum or PCC, we have not been able to create an integration. We are working on that and working to make sure that it's mostly a bottleneck on PHR's end, to be honest. We wish we could, and we're looking forward to creating a relationship with them that would allow us to do that. We do run into more often non-pediatric specific ones like eClinical Works, Athena, Greenway, those sorts of ones.
Yeah.
And those we do integrate with. So a lot of the times we don't run in that often to, especially not with PCC. With Office Practicum, we do run in every once in a while, but it hasn't been as much of a priority so far.
Okay.
Medicine here in New York is actually also very big.
Yeah. So what is the different process? Let's say PCC, someone has that, and the process of giving a vaccine to a kid. You take the bottles out of the refrigerator, you scan them, do your typical documentation and so forth. And so so when someone is scanning, they scan into your software running on a laptop somewhere, I assume.
Yep.
And then that uploads to your cloud, to your servers, and you do your thing. And how does that get into the EHR if there's no integration?
Right. So at the end of the day, you would essentially have an ability to download all the information of the work that was done by the end of that day, right? And we haven't done any integrations with PCC specifically, but the way in which we would set it up is to say, let's say we look at what it's like to import data into PCC, and let's set it up so that it's in the exact format that you need, right?
Right. Okay.
And once you do that, you'll download the records of everyone that you vaccinated that day, et cetera, and re-upload it at the end of the day. And so the goal is, it's just an additional step at the end of the day, should take 5-10 minutes.
Okay.
That would allow
So
you to
let me ask, and I'll profess my ignorance in technically how this works. So what you're saying is you could, based on the EHR, you distribute a file, right? That and then that file is uploaded into the EHR manually, and that populates the fields in the patient's record. So one does not have to put in manual entries for each vaccine in each patient's record. Okay, so that's good. That's okay. And if there was integration, how's the process different? It sounds like you wouldn't need to upload a file.
Exactly. That's the big difference. It happens more in real time. We can look at your schedule more effective. So we can look at your schedule also in real time, so that we can pull up information from your EHR so that you can see that while you're going through the process. For example, like your schedule is the first part. One thing that we're looking to integrate right now would be, for example, those charts that show you what vaccinations each child has received. We don't have that yet in our platform, but it would be helpful just to make sure that we're not double vaccinating someone incorrectly or anything like that. Other information that we could pull in real time that helps us make better decisions at the point of vaccination. Oh, one more thing, insurance information. So because you have that insurance information in your EHR, we can double check that you're not giving this vaccine to a Medicaid patient.
Okay. And in terms of HIPAA compliance and so forth, does a patient have to sign off on this? Is it purely something between the practice and you? How does that
we operate as a business associate to the practice, essentially a little bit similar to an extension of your team. So while they are signing off on working with the practice, they'd implicitly be signing off on working with us as well.
Okay, so therefore you stand behind security, encryption, firewalls, whatever is necessary. So a practice can be sure. Okay, and let's say you go out of business tomorrow. Okay. All the data
Hopefully
is
not.
still, no, hopefully not, but funny things, or you're bought by Microsoft or something. Okay. So, but the data is still integrated into the HR and is still local. So there's no fear of that. They just have to find
Right.
another
We
way to
sync
get
it up.
vaccines. Yeah.
Yeah, we sync it up daily at the latest, right? Because we want to make sure that the immunization registries are uploading information early. I know that we had talked about how New Hampshire doesn't have anything, but at least here in New York, you have to have that upload happen in 24 hours of the vaccine being given. And so at the very latest, we'll be syncing up daily.
So each of these registries around the country have different rules, regulations, and you're in compliance and make sure the practice is in compliance with that. So that's great. So at this point in time, you've been around for a year. Okay. Are you at liberty to say how many pediatricians or how many practices you are serving at the moment, or you would you prefer not to say? I know you
Yeah,
like
well,
everybody.
one of the things that has been really interesting is um, getting off the ground with COVID, right?
Yeah.
And I think that's one of the things that we had mentioned is essentially that we have a lot of pediatric practices who we've started with our first few pilots of the actual product in full, but we do have a lot of pediatric practices that are starting to get set up with us just for the COVID corner of it all.
Okay.
And what we do there is essentially everything we just talked about, plus a scheduler that would allow you to schedule vaccines and schedule appointments for vaccines. Um, and we're offering that for free. So while we test the more core product, we have this kind of lightweight version of our product that is more widespread. Now, I will say we are just getting that product off the ground and getting things started there because a lot of pediatric practices have not received vaccines, so it really hasn't made sense to go give that many integrations. But so far, we've got a wait list of about 20 practices here in New York doing that. And we're growing that week over week. So really looking to
So at
have a
this
big number
point,
there.
you're in the pilot stage. You haven't
Yep.
implemented this widespread, but you anticipate doing so.
Yep.
Okay. And with that being said, let's say you've got a lot of people viewing this video and they're very interested. How do they contact you and find out more about the nuts and bolts of getting involved? And when would you be ready to, release it? When will it be operationally available for use?
Yeah. So I would say there's two kind of main things here. First is the COVID product. If you're interested in using the COVID product, that we will have, we're already starting to launch with as many people as would want to use it. That doesn't include any financing, especially because COVID, we don't need to finance anything. It's all financed by the government. So that's really the light version of what we do. That would be available right away, and you can go to Canid.io and contact us. There's a space, or just email us at info@canid.io, and we'd be happy to connect with you and get you set up.
Okay.
For the more financing products, basically, we're doing our proof of concept to make sure that everything runs smoothly at the moment. I would expect the next 2 to 3 months, we're starting to open our doors to more and more people who are excited to use us. And we're already starting to build up a wait list. For now, very focused in New York, but obviously, we'd love to expand quickly. So happy to talk to and get people involved as early as we can and keep them updated about where we are with our growth and development. For the COVID product itself, that's already operational. We're happy to work with you right away to get that off the ground.
Right. But don't, a lot of states, like my state, uses Vinny. They used something else before and it's not very good, but it's the interface between the patient and, for making appointments to get vaccines. So your product is specifically for practices that
Yep.
are administering COVID vaccine.
Yeah, so there's a couple of nuances to how COVID vaccines are need to be administered, specifically around making sure that you've got blocks of 10 appointments, making sure that you're honoring a wait list. So if there's people who are, you know, can't find an appointment, they can sign up to your wait list, and that's what you use to make sure that you don't waste any doses, which is a big priority for the state. And also, there are reporting requirements that are slightly different. You need to make sure that you're talking to the CDC as well as your central immunization registry. So that's essentially what we do for COVID, as well as set you up with the scanning, the technology, all this the same stuff.
And again, a practice wouldn't have to pay you $500 for the equipment.
No,
It's still yours. Okay.
At a core, what we're looking to do outside of helping facilitate this for practices is to start building relationships with potential future customers. We're not, as we wouldn't want to, we don't want to charge you for this,
Right.
nor would we charge you for our core product again. But the focus is on using this as a way for people to also test the product in a lighter fashion, and to hopefully see the benefit of it, that they could incorporate into their bigger operation.
Okay, that sounds good. Thank you, Pedro Sanchez de Lozada. And this has been a very interesting conversation. And if people want more information, they should visit your website, which is Canid.io. And that's for input and output, is it not?
That's right.
Okay, and very cool. So thank you so much for your time. And I'm sure we will talk again.
Yeah, absolutely. Thank you so much for having me.